Turner syndrome, also known as chromosomal aberration, is caused by a random error that leads to a missing X chromosome in a male sperm or the egg of a parent. It affects about 1 in 2,500 female live births the world over. Today on Sound Health, we'll find out how to manage Turner syndrome. I'm Olasunbo Modupe. The program continues shortly. Thanks for staying with us. It's still Sound Health on Lagos Cell Region, and today we are looking at Turner syndrome, a female reproductive disorder. And I have with me an obstetrician and gynecologist, Dr. Chukwuemeka Odiega. Welcome to the program.
Thank you. Thanks for having me.
Okay, Turner syndrome affects about 1 in 2,500 female live births worldwide. What exactly is Turner syndrome?
Firstly, a syndrome is a collection of symptoms and signs. Symptoms are what you complain of. Signs are picked up by the doctor or the healthcare practitioner. And Turner syndrome was actually named after a particular person. His name was Henry Turner, who first described the syndrome in 1938. So Turner syndrome is actually a syndrome which occurs as a result of a genetic abnormality, a chromosomal abnormality, one which is referred to as monosomy X. That is, the female in this with this condition has a 45XO genotype. So one of the X chromosomes is either completely part of the chromosome is either a part or the entire chromosome is absent.
Okay. Is Turner syndrome inherited? Can a lady or a girl inherit it?
No, it is not inherited. There's no form of inheritance has been described so far, and also it's not also related to environmental factors. It's also not related to the age of the mother, which some of these abnormalities with karyotype are related to maternal age, things like Down syndrome. But this has not actually been shown. So actually nobody actually knows the cause, And to your second question, yes, it is exclusively found in female babies, female infants.
Okay, doctor, what is the prognosis for a person living with that condition? What are the things you look out for?
Prognosis-wise, because we've said that it's a chromosomal abnormality, so treatment is not cure, rather is not possible. Okay. However, we can have treatments for symptoms to minimize symptoms that you may present with.
Are there any health implications related to Turner syndrome, and can it be regarded as a form of disability?
Disability, that's a strong word. Yes, there are some health implications apart from features associated with the syndrome itself. There are also other health risks. It's associated with cardiac problems, heart problems, things like coarctation of the aorta, bicuspid aortic valve and other problems. It's associated with kidney problems, things like horseshoe kidney. It's the risk of developing diabetes in this group of individuals is higher. And then apart from that, problems with the thyroid gland, that is low thyroid hormones, particularly due to a condition that is called Hashimoto thyroiditis. So because of this, particularly the diabetes and the cardiac problems, it actually can lead to a reduction in their life expectancy.
Are there signs and symptoms to watch out for? For instance, in malaria, you look out for fever. What are the signs and symptoms to look out for when you're talking about Turner syndrome? When should a mother or parents worry about their words, living with the condition?
Signs and symptoms include, but are not limited to, include short stature, obesity, and increased weight. They have a characteristic fascia, you know. They have low set ears. They have a low, what is referred to as a low posterior hairline. That is, the hairline at the back tends to be low. You know, they might, apart from that, have what is called webbing of the neck as a result of something we call cystic hygroma occurring in infancy. You know, they could have problems, visual problems. You know, they could have problems with hearing loss and all that. They could have, as I said, they could have heart problems. You know, they could have, you know, problems with their, usually at birth, a good number of them may have swelling of their hands and their feet. Noticed at birth, you know. They could have problems with their hands. You know, there's one that they call the metacarpal 4, which tends to be short. You know, they can have problems with their fingernails and things like that. You know, they could, as women or as girls, you notice that a very broad chest. You know what some people call a shield-like chest with widely spaced nipples. You know, they could, and usually, well, if noticed around the time of puberty or adolescence, the mother might notice that the girl fails to menstruate. You know, and then in the absence of assisted conception, assisted reproductive technology, they usually cannot conceive. That is in the full-scale Turner syndrome. We also have the one that they call Turner mosaic, in which case some of the cells have the normal 46XX complement, while others have 45XO.
Okay. Before it gets to full-scale Turner syndrome, is there a cure or treatment for the disorder?
Well, as I said earlier, because it's a chromosomal problem, it's not something that is curable. But in terms of symptoms, there are certain things that can be done to minimize the symptoms. For instance, in childhood, if we notice that the child is short and before the time of puberty, before the time where the epiphyseal plates in the bones fuse, we can give them growth hormone. We can give them, in some cases, other kinds of hormones referred to as androgens, you know, which will help them to achieve their normal height. You know, that's an example. If apart from that, we can supplement them, give them what is known as estrogen replacement therapy, which may be in the form of combined oral contraceptive pills, you know, right from childhood. That will help them in attaining secondary sexual characteristics like development of breasts, you know, and even for them to start seeing their periods, you know. In adulthood, when it's now time for them to conceive, you know, when they are not talking about conceiving, we can offer them assisted conception in the form of IVF, that's in vitro fertilization with donor eggs, you know, because usually they have what are called strict gonads, you know, so they don't produce eggs the way we would expect.
What are some of the steps the Nigerian government can take to help those people living with this condition?
Well, that might be a bit difficult in this part of the world where we are dealing with, you know, problems. There's a lot of socio-economic problems. You know, I'm sure Turner syndrome will not be a major headache of the government right now. Mm-hmm. But of course, for those that are affected, it can be a very serious condition. So, well, increasing awareness, you know, even among healthcare practitioners, there are a lot of them that don't know anything about many of these chromosomal abnormalities, of which Turner syndrome is a very common one. So increasing awareness even amongst them, even in their curriculum during training, you know, providing support groups, Abroad they talk about things like Alcoholics and Anonymous and things like that. We can have groups like that. In Nigeria now, there are groups even that support groups for children with autism. I'm aware, so we can have support groups even for children with chromosomal abnormalities, including Turner's syndrome. Then also to supplement and to support them, parents financially. Maybe such treatments like those I've mentioned should fall under the health insurance scheme. So those are some ways the government can help out.
Okay, doctor, on your final notes, what advice do you have for parents and people living with this condition?
It's not a death sentence. Yes, because of complications or associated with Turner syndrome, we are made to understand that life expectancy might be reduced. However, with proper management of many of these conditions, a lot of them can actually achieve a normal lifespan, and with effective treatment in the form of hormone replacement, they can actually, achieve a normal life. So it's not a death sentence.
All right, thank you so much, doctor, for sharing your expertise with us on managing Turner syndrome.
It's my pleasure.
Okay, that has been Dr. Chukwuemeka Odiega, an obstetrician and gynecologist, on managing Turner syndrome. Sound health continues with trending and home essentials. Please stay with us. The program continues shortly.
This week on Sexual and Reproductive Health Rights. By allowing women to time and space the number of children they want, contraception prevents unintended, often high-risk pregnancies too close together, too often, too early, or too late in life that can lead to maternal and child death and injury. New Guttmacher Institute research estimates that the number of women of reproductive age in developing regions worldwide who have had an unmet need for contraception, that is, they want to avoid pregnancy but are not using a modern contraceptive method, has improved but remains high in 214 million women. These women account for 84% of all unintended pregnancies in developing regions. By satisfying this unmet need for modern contraception, the numbers of unintended pregnancies, unplanned births, and abortions would drop by almost 3/4. Achieving this outcome is a vital goal because the health benefits of helping women to prevent unintended pregnancies are substantial. An estimated 308,000 women in developing countries will die from pregnancy-related causes this year, and 2.7 million babies will die in the first month of life. Fully meeting the unmet need for modern contraception would result in an estimated 76,000 fewer maternal deaths each year and 480,000 fewer newborn deaths. Being able to time and delay births is especially critical for adolescents younger than 18 who are at greater risk of pregnancy-related death and complications and whose children face higher risks as well. For all women, spacing birth 3 years apart lowers infant and child mortality rates. Additionally, longer birth intervals improve other child health and nutrition indicators, such as by increasing breastfeeding and reducing the incidence of stunting and underweight children.
That's Sound Health this week. Hope you've learned a few things about managing Turner syndrome. For comments and inquiries, please send SMS on 0818-815-3695 or follow us on social media at HealthTV Social, #SoundHealth. A sound health is a sound mind. Make healthy living your choice.